Right. So I think everybody already know that a lifestyle with the prolonged sitting and lay down is not good for our bone and joint. But what kind of exercise or physical activity will also impact our joint and bone? Definitely, yeah, because of according to the survey views already proved that clinically proved that two common injury to our bones and joint. First of all, because of our lifestyle. If you prolong sitting and lay down, definitely it will impact to our bone and joint. With very little no exercise, very little to no exercise implied in a secondary lifestyle. According to WHO, a sedentary lifestyle can result seriously implication of our health. So, but another way, physical inactive promote the coordination is quite serious because of which is the negative affect our body normal functioning. So that's why people will think about, oh, how about we do some physical exercise? But in another way, if you too active in the physical exercise also will impact to our bone and joint. All right. So this is the two common lifestyle will injury our bone and joint as well. All right. So why? Because of first of all, if you are physically inactive, definitely it will make your muscle become weaker. And also because of insufficient joint flexibility will also impact our joint as well. So for those who are too active, which is training overload error, and also this kind of person they have insufficient warm up before the physical activity, and also maybe because of the incorrect posture, and there are overextended joints were caused by this kind of overloading training. Right. So these two kind of people they need to be careful for their bone and joint. All right. So once we're talking about the bone and joint, definitely we need to learn about what is our bone. Right. So people who don't know that how many bones we have. So let's make a guess how many bones we have for adult. Maybe you have so many answer for it because of if you are adult, definitely the 206. So fast already get our answer. Definitely for adult we have 206 pieces of bone. But for newborn baby, how much the bone they have? Yeah, they have 305. Why? Because of those baby skeleton is mostly made by the cartilage. And as we go, the baby growth and the child growth, the bone begin to fuse together and resulting of fewer bones. And at the age near to 25, which is adult, the bones stop growing. So that's why just like give you an example, like our lips, it will fuse together or merge together, become fewer bones. So that's why once we go up, become an adult, we only left 206 pieces of bone only. All right. So when we're talking about the bone, what is the function for our bones? Yeah, bone are built for supporting your body and help you to moving. Right. So those bones literally hold up your body and keep it from collapsing to the ground. So your posture depends on your bones. So that's why bone is so important for you. You also need what kind of bone you need to able to coordinate your bones to shift your weight. So that's why this is the most important part because of once you gain weight means that you are giving the pressure to your bone and your joint. So around this bone to help you to move. All right. So secondary because of the bone protecting your internal organs. So bone is external and then the organs is inside your bone, and those bones keep your organs to be safe from the hard impact, punches, or even though other forms of injury. So for example, your ribs protect your heart and lungs, right? So and your skull protect your brain, right? So the third one is producing your blood cell, right? Why? Because of certain types of bone makes your platelets, red blood cell, and the white blood cell. And this cell is made inside your bone, right? So platelets help your blood clot, right? The red blood cell deliver the oxygen to all your organs. And the white blood cell, yeah, is so important for your immunity, right? So the last function for bones is storing and releasing some minerals. What kind of minerals they are storing? Do you have any answer for it? What kind of mineral they store in the bone? Nobody know. Hello? Yeah, calcium, only calcium. Yeah, majority is calcium because of 99% of calcium stored in the bone and 60% of magnesium also stored in the bone. So that's why it's so important. This kind of function of the bone is storing and releasing minerals. Means that if your body needs more calcium, which is your deficiency from your diet, definitely they will release the calcium from the bone. So you will see why your calcium inside your blood is getting available because of your body need calcium and it is released from your bone, right? So after that, let's see. After the maximum bone density and strength is reached, which is what what age we become the maximum bone density? Yeah, it's 30, around 30, all right? So you will see in this curve, maybe start from 35, your bone density is getting lesser. All right, the bone mass is begin to naturally decline with age. So everybody is aging, right? During this aging process, our bone breakdown begins to outpace the bone build up and result this kind of curve you will see the blue light represent the male and the pink light you will see represent the female. Why they are different, right? Because of you will see a obvious drop for the for this pink curve because of what? Because of menopause. All right. So because of me, female, they have a process so-called the menopause, and this directly relationship between rate of estrogen. And because of during menopause, estrogen, the level of estrogen is getting lesser and lesser. And during this menopause or perimenopause means that before the menopause, the development of osteoporosis is starting. All right. For those early menopause, which is before age 45, and any prolonged periods in which hormone level is getting lower and the menstrual periods are absent, also can cause the loss of the bone. So you will see why female, their body is so complicated, and because of they need to go through a process so-called the menopause. So you will see this curve is slightly different from the male. All right. So after we're talking about the bone mass we getting lost because of aging, and there are so many causes or so-called the factors of osteoporosis. First of all, as you're aging, definitely they will getting lesser, and your bone continue to change and become weaker and thinner. All right. So what is the causes? First, heritage, genetic. All right. The second factor, definitely, just now we already mentioned, inactive lifestyle. And third one, yeah, because of the cigarette or the alcohol. And last, people worry about, oh, if you are a tea drinker or coffee drinker, you need to take caution because of every cup of tea or coffee that contain certain amount of caffeine, and caffeine can cause your bone loss, especially the calcium, right? But not that much, only 6 milligram per cup of coffee. So no need to worry, but still a factor. We need to take caution. All right. So as your age, everything will change, including your bone. And your bone becomes what? Becomes thinner, looser, brittle, and also maybe it will cause you some another problem like the hatchback and the facing aging, right? So-called the facing aging will make you look older, right? So people worry about that. If you are a female, definitely you will care about this because of the facing aging is so obvious. Everybody will see. So everybody will compare, oh, you are 35 and after 20 years later, you look older. Definitely you look older, but if your skeleton or bone mass lost faster, definitely you will be aging faster. Why? Later we'll bring it on. First of all, we're talking about the osteoporosis. And for those normal bone, you will see from the left-hand side, the structure is quite solid. All right. So after the bone loss or the calcium loss, you will see it become much more fragile. All right. So 1/3 of the female, they have the osteoporosis above 50. And for male, 1 in 5. Right? So why female become getting more people having this kind of osteoporosis? Why? Just I mentioned because of menopause process. Right? So now we are talking about your face aging, your facial aging, because of the changes in the facial skeleton with the bone loss. You will see from here the dark spot is the bone loss. Once this part, the bone is lost faster, means that the skeleton, the facial skeleton having a little bit changes. And you will see from second graphic here is quite obvious for those ice pack. Why ice pack become so obvious after you getting aging? Yeah, because of your facial skeleton already have some changes due to the bone loss. From here you will see, right? I already make a circle here. From here you will see this is the cubic side, shape, and then you will see from here the ice pack come out already after your facial skeleton have this kind of bone loss problem, right? So the darkest area are those greatest bone loss, right? So it will make you look older as well, all right? And another thing is the nasolabial folds, all right? So why everybody getting this kind of nasolabial folds? From here, you will see once you're getting aging, this line is become much more obvious. Yeah, because of some bone loss over here. All right. So this cause we look older once we having this kind of facial skeleton bone mass, bone loss, right? So the best, sorry, I have typo error. The best bone building formula. Yeah, everybody know about this. Yeah, especially for our USANA Medical D. Why so different from the other? Because of it offer the ratio 1:1 of magnesium and calcium, right? So for the other products in the market, definitely maybe they will put a certain amount of magnesium inside, but this ratio is so important because of according to the scientific study, we need at least 2:1. And because of our scientists worry about our diet didn't getting enough of magnesium. So that's why our scientists recommend the formula change to the ratio 1:1 for calcium and magnesium. And other than that, why we need that much of magnesium? Because of magnesium help us to absorb calcium, to hold the calcium in our bone. And without vitamin D, your calcium cannot become minerals to nourish your stronger bone. So that's why you need vitamin D as well. All right. So other than that, we also contain silicon and boron. Why we need these two elements? Because of medical D put this silicon and boron because of silicon helps to promote the bone growth and hasten the mineralization. Mineralization of calcium is so important because of once you're eating any food, the sources of calcium, this kind of calcium in another form. And once you need to transform into the bone, you need to become a minerals. And this process we need to go through, so-called the mineralization. And this mineralization, you need one element to do it, which is silicon. All right. So the minerals also gives stability of connective tissue. Okay. So another thing is boron. Why boron is so important? From here, you will see to reduce the calcium acceleration and increase the deposit of calcium. And because of boron also play an important role to maintain this so-called reducing the calcium acceleration and increase the deposit of calcium. So it is the balance of calcium inside our bone. So you need boron to do this kind of job. All right. So overall, you will see why we need that much of nutrient to put it into a product so-called the Magnecel D. So from the name of the products, which is include magnesium, calcium, vitamin D, and also silicon and boron. All right. So I think everybody will listen so-called the hearsay. So hearsay or so-called a myth of taking calcium, they have so many types of people talking about, oh, I no need to intake the calcium supplement because of every day I drink a cup of milk. Is it the milk is the best sources of calcium? No, everybody will deny because of other food source also can provide you certain amount of calcium. Why? Because of one important thing is bioavailability is so important because of every kind of food source, the ability is different. Like spinach, they have only 5%. Even though inside the spinach, they have a bunch of calcium, the amount of calcium is so high, but there are only 5% you can absorb. And for sesame and the beans, about 20 to 30%. Dairy like the milk or the soy products, only 30 to 32%. And the highest score is the cauliflower, like the kale, about 60 to 70%. So if you are a vegetarian, no need to worry because of you need calcium you can absorb from the cauliflower vegetables. So called these are the first sources of calcium. All right. So, and people will ask you about, I'm worried about the kidney stone lah. And because of doctor told me that if I'm taking too much of calcium, maybe it can cause the kidney stone. Did anybody have this kind of hearsay, so-called hearsay? Or maybe people told you about same story about the kidney stone if you're taking too much of calcium. Yeah, Elaine, and then many customers definitely, yeah. You need to study about what types of calcium you are taking. First of all, what is the format of so-called kidney stone? Yeah, it is the calcium oxalate, and we don't add calcium oxalate inside our products because of we only use the calcium carbonate and calcium citrate. And why we use not only we use these two types of calcium because of they have pros and cons, right? Calcium carbonate, it contains more elemental calcium per pill, and it need acid like gastric acid to dissolve and absorption, and also maybe can cause some stomach gas. But in another hand, the calcium citrate, it contains less elemental calcium, but it doesn't require stomach acid like acid for absorption of this kind of calcium. So that's why both of them, they have pros and cons, but combined together, it makes a better formula. But we don't use the calcium oxalate, which is people will worry about. But people will think about if you're taking too much of calcium and in the same time you also eating some veggie, and this veggie also provides some oxalate, and oxalate combined calcium become calcium oxalate, is it? Yeah, but this kind of risk is quite low. All right, so no need to worry about this. And later on we'll bring up what is the main factors of kidney stone, right? So another thing is, oh, people will do some blood tests and they found that inside the blood, the calcium level is quite high, so-called the hypercalcemia. Did anybody have this kind of problem? Or you heard anybody have this kind of problem? After the blood test, the doctor tell you that, oh, you already have so high level of calcium inside your blood, and so-called the hypercalcemia. Anybody have this kind of problem before, or you heard before? No, no. Yeah, first time. All right. So, yep, Pamela, definitely some people will tell you about this kind of facts that I already overload of calcium because of inside my blood, I have higher level of calcium and so-called hypercalcemia. And this hypercalcemia actually is quite dangerous. All right. So the major issue or major factor is not because of you are taking too much of calcium. It's because of overactive of your parathyroid glands. All right. So you have to do a further checkup to test is it you having so-called cancer because of for those cancer patient like the lung cancer, breast cancer, and blood cancer, this kind of patient they have hypercalcemia problem, right? So another types of patient like the overactive parathyroid glands, they also have hypercalcemia, right? So secondly, maybe because of you are taking too much of vitamin D, like you are taking over 4,000 IU of vitamin D, and too much of vitamin D maybe can cause the hypercalcemia, which is high level of calcium inside your blood. And maybe another factor is because of kidney failure. Because of if you are having this kind of kidney failure can cause because of once your kidney dysfunction means that they can not run properly, they cannot do the calcium acceleration. It will cause all the calcium start to accumulate inside your body and generate this hyperglycemia, right? So if your friend or even though somebody else tell you that they're having this kind of high level of calcium inside their blood, so-called the hyperglycemia, definitely you need to advise him or her to go for the further checkup for their cancer or maybe their kidney or their thyroid, right? These three things. And maybe you can ask what kind of medication they are taking. Maybe some medication can cause hyperglycemia, right? So this is the main factor. It's not related to you are taking too much of calcium, all right? So now we are talking about the kidney stone. Okay, can calcium supplement cause kidney stone? Yes or no? Give me an answer here. Let's see, yes or no? Why so silent? No. Yeah, maybe your friend tell you that definitely you will say no because of you are selling the calcium supplement. So what is the answer? How to answer for this kind of question? Right? So definitely we need to start just now they mentioned what is the main causes? The calcium oxalate. And why the calcium oxalate can form? Because of this. You are dehydration. Okay, because of your drinking 2 liters of water. Okay, dehydration can cause the kidney stone developing, and because of your diet. If you are taking those diet like contain so high level of so high amount of protein, sodium, like the salt, and sugary diet, this so-called the heavy diet can cause the kidney stone and low calcium diet as well. Why? Because of you are taking the low calcium diet, definitely your body need more calcium. All right. So that's why they will start to release those calcium from where? From where is it? Just already mentioned from our bone. So that's why this calcium will start to release from your bone to your bloodstream. And once this bloodstream contain any oxalate, they will combine the oxalate with the calcium, become calcium oxalate. All right. Then it will form kidney stone. So now you know how the kidney stone will form and why, and how to answer your friend, all right, or your customer. Okay, so maybe people don't believe that. Oh, all right, we show them the clinical study. Okay, based on the JAMA, which is the medical journal, they already show you that in summary, they found to indicate that higher intake of dietary calcium decrease the risk of kidney stone. Means that it is opposite to those he said. All right. So it will decrease the risk, not increase the risk of kidney stone formation. Okay. So it is lack of increased risk with greater intake of calcium. All right. So that's why now you know also from the clinical study can prove that even though you are taking the dietary calcium or supplement can decrease the risk of getting kidney stone because of you can solve the low calcium diet problem. All right. So another thing is maybe people will start to ask you, oh, you are selling the fish oil and you're selling the calcium. Can they take it together? Can or cannot? What is your answer? Why not? Yes, 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 yes. But you need to give the reason because of people will. I heard somebody say that calcium cannot take with fish oil. And you will ask why, and then they don't know that. Because of he say, him say, her say. So-called a hearsay. Right? So did anybody like to eat the steamed fish? Okay, steamed fish with tofu, so-called the teochew steamed fish. Okay, in the background of the graphic, you will see a fish was steamed with using the tofu. Right, tofu contain calcium. So fish contain fish oil. So why they cannot mix it together? Definitely they can, because of in our diet we have this kind of issues. Yeah, so why cannot? People will worry about. Then you show you the proof. Okay, so they have no interaction in between calcium and vitamin D, or so-called the fish oil. Okay, so this is the proof. Yeah, just log on drugs.com, you will see they have totally no interaction in between calcium and fish oil. So no need to worry about this. And now we are talking about the joint. Okay, more than 200 joint we have. And where is our joint? It's the connection in between two bones. All right. This is one bone. This is the second one. So in between this, so-called the joint. All right. So we have around 200 joint, not only your knee joint, not only two joint. We have more than 200. Okay. So based on the study, show up that we have 43% of Asian is suffering from osteoarthritis and joint pain. Just now we mentioned about the osteoporosis. Now we are talking about the osteoarthritis, which is majority happen in around our knee. All right. So why we Asian, about 43%, we are suffering this kind of joint pain or osteoarthritis? Like they already done the survey in China, Korea, Malaysia, and Thailand. They found that there's so many population in Asia that are suffering this kind of problem. All right. So now you will see they are not only for the elderly, but most of the Asian. All right. And there are another facts which is show up that around the world we have 350 million people is suffering osteoarthritis, and in Malaysia ourselves we have 2 million of elderly, which is our senior citizen of Malaysia, is suffering the osteoarthritis. Okay, so especially for those 70 and above, they have 70% of 70 years old and above senior citizen, they are suffering the osteoarthritis. Okay, but not only our elderly, but also based on another study which is done by the they have found that 20% of this age 18 and above, they also suffering the knee pain. Okay, so don't think about osteoarthritis only happen for those elderly, but 20% of them maybe they are 18 above only. So that's why you need to be careful if you are so-called the adult. So every adult, they have the risk of getting this osteoarthritis and so-called the degenerative arthritis. Why? Because of in between these two bones, so-called the knee, so-called the joint, they have some bone lapse against the bone and causing the pain and stiffness and cause the limited mobility. So this so-called the osteoarthritis. And why they will happen? Now you will need to study about what is those signs and symptoms of osteoarthritis? First of all, definitely the joint pain. And secondly, because of the stiffness and some loss of flexibility. And third, grading sensation. And the last is swelling. And swelling is either hard or soft swell. They also represent the sign and symptom of osteoarthritis. Okay, so osteoarthritis, it didn't happen over a night, but it over years, right? So why? Because of we have four important so-called nutrient we need to support our joint, which is our chondrocyte, water, collagen, and cycloprotein. These four elements is so important for our joint. So now we are talking about how they are becomes the osteoarthritis. They are step by step. First of all, start with the cartilage damage. And secondly, because of your cartilage already start having this kind of damage, and they will activate and synovial macrophage. And this macrophage can generate pain, swelling, and also can cause you some reddish. And now we start having some proteinase increase. And after the proteinase increase, if inflammation will happen around your joint. And this is so important because once the inflammation happens, pain will come and swell will also impact your daily life. Okay, so so-called the osteoarthritis also can call it as the inflammatory joint problem. Okay, and why the osteoarthritis more common in female? Okay, because of first of all the weaker muscle support. Yeah, because of women that tend to have smaller and weaker muscle if you compare with male, and that muscle which is can support your knee is smaller and weaker than male. And also the female, because of their hips are wider than male. Okay, so because of they need this so-called pelvis to have the let the baby bone. So that's why they are a little bit different of the structure of the hips if you compare with the male. And this angle to form by the hip bone being wider than the knees put more stress on the outside of the knee. So that's why osteoarthritis is much more common in female. And last thing, yeah, about the hormone, estrogen problem. As women having this kind of menopause problem, yeah, now we are talking about the estrogen. Their estrogen level is getting declined and decreased. And because of estrogen is so important to help to fight for the inflammation, and which is the factor to increase the arthritis. So that's why just now we mentioned, once you're having this kind of cartilage damage, the end result is inflammation. And inflammation, you need estrogen. But after you are menopause, you don't have that amount of estrogen to fight for the inflammation. So that's why osteoarthritis will be more common in female. Okay. So the causes of osteoarthritis definitely when we have heavy lifting, and even though when we walking, the weight on our knees, they are 2 times of our body weight. So that's why if you are a fat guy or fat woman, definitely they will put much more stress or so-called the impact to your knee. And about 4 times when you are going up hills or let's say, and also once we are running, or even though they have 6 times of the pressure when you're playing some ball game like shooting or even though football, soccer, or even though baseball, and 8 times of the pressure you will give it to your knee when you are doing the squatting and kneeling. So, so-called the causes of osteoarthritis. Right. Give you an example. If a person which is weight about 70 kg and they weigh about 280 kg on their knee joint every time they go up to the stage. So you will see why the downhill or even though you are climb any stage will give you much more pressure on your knee, right? So what types of sport game which is can cause the injury to our bone and joint? What types of sport game? Let me make a guess from here. Is it badminton, baseball, basketball, volleyball, or even though tennis, hockey? Other than that, football, jogging, running. Yeah, just now I already mentioned running also. Yeah, definitely. Let's see. Once you look at the logo from here, who will represent in your mind? Who is it? NBA. Michael Jordan. Yeah. And Dr. Nanjun is correct. It's Michael Jordan. But do you know why Michael Jordan was retired at around 30 something? Even though he rejoined NBA again, but only I think few seasons he also retired again. Yeah, sport injury. What types of sport injury is it? On which part? Definitely joint knee. Yeah. Michael Jordan, about 40 years old, he already having this kind of osteoarthritis. Okay, so I think according to the survey which is done by GE and NBA, they are collaborating a research which is to improve the diagnosis and treatment and prevention for the musculoskeletal injury. And they found that NBA players, they are commonly injury their neck about 9.3%, and for their thigh about 9.7%, for knee 13.9%, and the ankle 19.5%. Okay, so these are the problem why we are not recommend you to do that much of ball games, especially the basketball. And other than that, those others injury by the other types of games like the baseball, softball, soccer, so-called the football, they also fractures the ankle and knees. If you are, according to the study, which is if you are aged like 25 to 40 years old, definitely you need to be careful if you are playing the baseball, softball, or even though the football. And 6.6 million of the knee injuries were reported to U.S. Emergency Department from 1999 to 2008. So another figure, which is the sport-related injury make up about 20% among the children aged 6 to 19. So every types of so-called the physical activity, you need to be careful because of every types of physical activity, definitely they will impact to your knee, ankle, and also the other part of joint. So that's why you need to be careful about another types of physical activity. They are so popular in Malaysia. Let's make a guess. What is it? Yeah, once you see the mountain. Yeah, definitely people were thinking about the hiking. Yeah. Researchers also suggest that the force on your knee, on your knee joint, is up to 2.5 times of your body weight when you are going uphill. And once you are getting downhill, they are 3.5 times when you are going downhill. So these forces on your knee can develop the osteoarthritis on your knee, right? So if you have this hiking hobby, you need to be careful, all right, on your knee. But how to protect our knee? Okay, now is the question: how to protect our knee? Okay, we need to lose some weight. Yeah, because of just already mentioned, if you are a fat guy, this body weight will impact to your knee to boost some forces to your knee. So that's why you need to lose some weight first. And secondly, you need to find a light shoe because of the right shoe can relieve some stress from your exercise and the princess and the protector. Okay, so you need to wear some protector around your knee. If you have some problem on your knee, definitely you need this protector. And if you have some uh, joint problem around your arms, definitely you need to wear another types of protector on your arms. So that's why these are the recommended uh, how to protect your joint. And another thing is what types of exercise are recommended for osteoarthritis patient. Yeah, cycling and swimming. And you also need some armrest. When you are walking, if you are elderly, definitely you need some walking stick. Yeah, this is the way to protect our knee or even though our joint. So other than that, you need to take some food which is contain some anti-inflammation nutrient which is can come from our food. What types of anti-inflammation ingredient or nutrient we are talking about? Do you have any answer regarding this issue? Any nutrient can anti-inflammation? No idea. It's quite obvious from the fish, from the ginger, yeah, turmeric, okay, and from the fish, what the fish can provide you to anti-inflammation. Yeah, omega-3. Yeah, but now is the tricky question. Omega-3, everybody know they have ALA, DHA, EPA. And what types of omega-3 fatty acid can anti-inflammation? Oh, Dr. Danjun, yes, it's EPA, right? So EPA is the main ingredient inside the fish, which is have the uh, property of anti-inflammation. Okay, so other than that, now we are talking some myth of the osteoarthritis. Okay, so there are three types. Majority we have three types. I think more than that lah. But I think it's quite common. Is three types. First, osteoarthritis mainly happen on our knee, and secondly, we have the rheumatoid arthritis, and last we have the gout. All right. So don't make some confuse in between the osteoarthritis and rheumatoid arthritis because of they are totally two different types of arthritis. Okay, one because of this so-called rheumatoid arthritis is because of what the major factor is they are so-called what nobody know. Yeah, because of autoimmune. Yeah, because of this autoimmune is the first factor. Definitely they are linked with our heritage, our genetic problem. And most of the patient, they are 30 to 50, but mostly they are caused by the genetic problem. If you have some family history, definitely you need to take put more caution on this rheumatoid arthritis. And mostly they are related to a cell, so-called the HLA-DR4, and mostly happen on the female. And they are 3 to 5 times than male. And last thing is the, the higher the risk of, for those smoker, they are 4 times higher than the normal person. So that's why if you are a smoker, definitely you're having the higher risk than the other. So that's why these are the major factors of rheumatoid arthritis and some features of so-called the rheumatoid arthritis is, first one, they have some symptom, which is the morning stiffness, more than 1 hour. Okay, so for normal stiffness, which is only about 15 minutes, they don't consider the rheumatoid arthritis, and they they will involve more than 3 and above of the joint having this kind of arthritis. So they are not only happening on one of your knee, but they are both because of their symmetry. So symmetry means that both your hand and both your leg having this kind of uh, joint arthritis. So majority they are happening on your fingers. From the left hand side, you will see those finger, the shape is quite weird because of they're already getting the rheumatoid arthritis. Okay, so these are the autoimmune problem. Okay, so this is not because of you are aging, but if you have higher factors like both, like the genetic problem and related to the cell, and some, especially you are female and you are smoker, you are getting higher risk of getting this rheumatoid arthritis. Okay, but another types of arthritis, so-called the gout. And what is the problem? People were asking about, did those gout patients cannot eat those seafood, beans, and mushroom and beer? Is it all the food? Yeah, definitely. All the food we are mentioned here, which is the seafood, beans, mushroom, and beer, they contain so-called the purine. And only purine, they will cause you the uric acid. Okay, so but you have to get another information about this purine, because of not every purine will generate the uric acid. Yeah, everybody know about the purine are the substance in our food that your body can convert to uric acid, but not all types of urine. Okay, not all types of purine. Okay, you are taking some purine food like the mushroom and bean, they wouldn't cause the gout. Okay, now people will ask you, oh, your product contain mushroom. Yeah, what product we contain mushroom? What kind of product we contain? We have in USANA contain mushroom. Nobody knows. Yeah, for curcumin. And how about beans? Soybeans, beans. Yes, we have so many products contain soybean. Okay, so now you have another problem. I cannot eat soybean because of I'm afraid to get gout. So H4 cannot take, Nutrimilk cannot take. Oh, I see every label. I see you are using the soy lecithin as well in our tablet. Then every tablet USANA product I cannot take. Do you have this kind of problem? Yeah, definitely, because of people worry about, oh, I see soy lecithin. Soy is so-called the beans, so cannot take it. No, because of that we only use the soy lecithin. It's another types of fatty acid which is we absorb from, we extract from the soil, but we didn't use the whole beans. And this whole beans, because of purine, is considered a types of uh, uh, so-called the amino acid from our food. And this purine only inside the beans, but we only extract the lecithin, so it will involve the purine. So definitely, if you see soy lecithin, no need to worry about this, because of soy lecithin is not the purine, so it will cause gout. And what will cause the gout? If you're not talking about the beans and mushroom, but how to prove it? Yeah, definitely. There have so many studies already prove that if you are vegetarian, eat a lot of beans and mushroom, because of they are the uh, amino acids source of the food. So that's why if you study from the vegetarian, even though they compare with the non-vegetarian, okay, so vegetarian have lower concentration of triglycerol and uric acid. Now you see why vegetarian that eat a lot of beans and mushroom, but they don't have uric acid problem. So why? This already proves that even though you're taking some beans, mushroom, it won't cause uric acid, even though they are considered the purine. Okay, so later on we'll make it, let you know deeper why. Okay, now we study from the critical journal first. Okay, so they have another journal which is already done about 2004, 2011, and 2007. All journal already prove you that vegetarian didn't get higher level of uric acid, okay, compared to the non-vegetarian, which is you eat meat lah, you eat seafood lah. For those non-vegetarian, they got higher level of uric acid. But why? You cannot explain it. Later on, we bring it to you, the answer. Okay, now the other survey already done by the Singapore University. Okay, so the proof that gout patient, if you eat soy or even though the soy products, by this Singaporean study, they already proved that, and they already confirmed that soy, even though they are high in purine, they are not associated with higher level of uric acid. So now from here, another proof. And another study in 2015 involved more people, which is 63,000 Chinese population living in Singapore, show you that higher total of dietary protein intake from the mainly foreign and the fish, shellfish, so-called the seafood, was associated with an increased risk of gout. So now you see, it's not a problem of bean and mushroom, but the problem is come from the fish, shellfish, and the other probably. So that's why now you will see the red meat, the fish, the seafood can cause and increase the risk of getting the gout. So now you see, not because of you are taking the soy, the non-soy ligaments, they don't have any issue to increase the risk of gout. Okay, so now the last journal from BMJ. Okay, the British Medical Journal also involved more than 16,000 individuals of European. Okay, now he's talking about the European. Half of them are men and the other half is women. What is the major issue to increase the risk of getting gout? Yeah, because of red meat, because of shellfish, because of alcohol. And the last thing is sugary drinks, especially the fructose. Okay, so but how to lower down the uric acid level in our blood? Yeah, you need to take certain amount of low-fat milk, coffee, vitamin C, and berries. So now you will see our natural food like coffee and berries, even though the low-fat milk can help us to lower down the uric acid in our blood, and by the helping of vitamin C. So now you will see not you are taking some other products, but from the natural food as well. Okay, but why? Now people ask you why. Because of only 20% of the uric acid is generated by your food, and the other 80% they are synthetic by your liver and intestine. So that's why it's your organ problem, not the food problem. And for those, if you are male, the pool of uric acid about 1,200 mg, and for female, the pool of your uric acid about 600 mg. If you are overload, means that you need to do some use for the metabolism about 60%, and another 40% you need to extract it. So extraction about 40%. So you need to do some extraction. By which organ is it? Which organ will involve? Yeah, it's because of you need your kidney and your large intestine. So that's why it's 30% from your large intestine and 70% from your kidney. So if you have some kidney problem, definitely you cannot extract too much of uric acid. Now you will see why we getting high level of uric acid in your blood, because of your kidney dysfunction. Now you know. And where they are come from the organ, especially from the liver. So why we strongly recommend people to start with our health GPS, the rejuvenation which is involved our hyper cell, okay, our digestive enzyme, the fiber. So all these products, they are involved to improve your organ function, like your liver, your large intestine, or even though your uh, metabolism function. So all the products, they must link together, and all the nutrients, they also work together. So don't rely on only a vitamin C can lower down uh, uh, the uric acid level. So I only take vitamin C, try to reduce your uric acid. No, but you need to make sure your liver is having the normal function, and your large intestine, your kidney, they can work properly. Then they can do the job to extract uh, that much of uric acid from your body, and it won't make your poo overload. All right. So, and another problem is we're talking about the bone spur. And this bone spur, everybody asking you, oh, did your body have this kind of function to uh, reduce the bone spur? The answer is no, because of you need to know why the bone spur can generate or develop, because of the joint damage from osteoarthritis, and because of the other issue is degenerative of your joint disease. So bone spur often form after the injury. Okay, so you need the surgery to remove it. So don't expect any medication or even though the supplement can help you to reduce or make the bone spur disappear. It's impossible. All right, so that's why strongly recommend them to look for the further checking from the doctor, or maybe the doctor will recommend them to do some operation. Okay, only operation can remove the bone spur. And is it safe to take glucosamine? Because of our proposal only glucosamine. A moment, please. Okay. Is it safe to take glucosamine if you are diabetes patient? Yeah, because of you see the caution on the label, but even though this glucosamine is technically a type of sugar, it doesn't appear to affect the blood sugar levels or insulin sensitivity. So definitely you no need to worry about it. But for some cases, certain cases, maybe will affect the insulin sensitivity. So that's why if the patient is diabetic patient, they need to take caution as well. Okay, so but only happen in the study which is not involve the human. Okay, all right. So that's why all three products they need to work together. Means that you need to take as a package to power your movement. So that's why we are strongly recommend you to do it. But we also recommend you to go through the rejuvenation package first because of we need to ensure your liver and intestine their function as normal. So that's why they can do the acceleration of uric acid, even though they will also can help you to stronger your bone if you are taking these two products together. Okay, so this is my testimonial so called because of in last end of before the Christmas last year I have some accident and I broke my arm. You will see from here my arm is also involved my cartilage, my joint. You will see some broken joint and bones and also involve my cartilage. So so-called the tipless damage lah. And doctor was told me that it's so seriously and I need to go through an operation. And about 29th of December already have had the operation and then to screw back my joint and so-called the bone. You will see there are four screw from here. And what products I take during this moment? Yeah, I only take these three products. Okay, so all three products I only take the recommended dosage, which is I take 3 tablets of Procosa a day and two capsule of Bio Omega 3 and 2 tablets of Manacel D daily. And about 6 weeks, I already recover. Okay, both my joint and cartilage and also my bone. And, okay, so that's why no need to worry about if you're having some problem, you need some nutrient. No need to overdose. Follow the instruction on the label. Really know that all the nutrients they work together, they help you to recover faster. It doesn't mean that it can cure your bone broken or even though your joint broken. No, they help you to recover by yourself faster. Okay, don't overclaim. Okay, so now is the section of our Q&A. Do you have any question? If you don't have, you can see you by next time.